Jenna impacted many people. So many people have shared things with us since she passed away. Many girls have said that she encouraged them when they were struggling. She understood what they were going through and talked them through really tough times. And then she goes on and she thanks the funeral home and some other places. So super, super sad. And the thing that I want to point out is that I'm not reading you that to point fingers. I would never do that, because the fact is we weren't there. We don't know what happened. But it should be a wake-up call to people to listen, right? Listen to your patients. Try not to make judgments ahead of time, even if people say things like they're a frequent flyer or anything else, because this is how things are missed, you know? And it is true. If someone had a big blood clot in their pulmonary artery, it is very unlikely that the outcome would have been different had they known that right away, because that's dire, and they would have had to phone her somewhere, and you know, it probably wouldn't have changed the outcome. But think about how her mother might have felt if, when she came in, they treated her like that's what was happening. That people stepped it up, right? Looked at her with empathy and compassion and seriousness for what she felt was going on, you know? And the other thing that I always find interesting whenever I read things like this, and sometimes you read them, you know, you get those surveys back, the places you work, and you get to read them, is when they talk about what they overhear you saying, because they hear everything. So it's really important that if we're within earshot of patients or family, we're really cautious and careful about the way we say things and what we say. So that was just unfortunate, you know, but you're all smart and you're all good nurses. So you got the proper take home, I think. Okay, so this last bit here is about people who live with chronic mental illness. So when you were in Choices, you saw people who were in crisis mode. Some of them had a chronic mental illness. A lot of them could be well controlled on medication. When something is considered serious mental disorder, the big ones that we think about: schizophrenia, bipolar disorder, severe depression, OCD, panic disorder. And when it's persistent, it just continues over a lot of years, and it affects their ability to function. So this is what changes it. When you can't go to work, when you can't go to school, when you can't continue on with your life as planned, then it becomes persistent, okay? And so we know that a lot of people get a mental illness every year. But then there's those people that just have to live with it. So people that have this persistent mental illness, right, they get the relapses, so your schizophrenics, right, or your people with bipolar disorder, for whatever reason, off their meds stop working, whatever, get that relapse. They might have the medication side effects that you all know about now. It could definitely cause someone to become hopeless. They will get those co-occurring medical illnesses. Remember, people are more at risk for diabetes and heart disease because of their medications. They could become unemployed. You know, now we have FMLA, which is really great because any illness falls under that. So if you have to take days off work, that will protect your job for a certain length of time, but that doesn't last forever. You get 12 weeks of that. So if you've outdone yourself in days that you can take off, you may not have your job anymore. Okay? Certainly poverty, then do you lose your house or your housing situation because you have no money? You know, so you've seen the trickle down of that effect. And then of course stigma, which we're all fighting so hard against. Makes people isolated and lonely. Certainly you've all seen the effects of inadequate treatment that's just plain not here. People can't afford the treatment that is here. And then substance use is really common. Along with this, it's either due to self-medication or being just plain old despondent about their situation. And then people with severe persistent chronic mental illness are actually double the rate of being victimized by society. So it's interesting because what the public thinks is that they will be victimized by people who are mentally ill, and unfortunately the mentally ill are the ones that are victimized by the rest of society, which is really too bad. So depression and suicide, you know, if you think about yourself now, you're functioning well, you're gonna get out of school and do your thing, and you get a persistent mental illness, and pretty soon you're not doing anything. You're unemployed, you lose your house, you live in a group home. It would not be a far stretch to see how someone might become suicidal over that, right? Everything changes. So when you have that significant change in your original trajectory to where you are now, the risk of suicide about 5 to 10%, okay? And when you don't have the support, remember that goes up. So one of the things they were talking about in choices with one of my last groups, we were talking about discharging people and how you know that they're not suicidal. And one of the things they said could change the discharge plan with the patient, even if the patient said they weren't suicidal, is that support system outside the hospital. If the patient had nowhere to go and no family, that is something they would take into consideration. Of course, it isn't perfect because we know that people get discharged to a homeless shelter. So sometimes that ends up happening. But they try really hard to get them somewhere or get contact with families so that they can know that there's some kind of outside support. You know what anosognosia was? That was on the last test, right? That's that inability to recognize your disorder because of your disorder. And the trick to that is always getting people to take medicine for an illness they don't believe they have. And that's the hardest thing. And so if we had more mental health care providers, they could spend more time, right, with patients, helping them come to terms. And, you know, using things like, I shared with one group, one of the other ways we can help people stay on their medications is by using things in their life that they need and want and connecting the medication to that. They know that they like to go to their job. It makes them feel good. It makes them feel productive. They earn money. And so if we say something like, you know, when you take your medication, you feel good enough to go to your job, they could relate the two, then it's not about their illness, it's about their job. And so if we can relate one to the other and leave the illness out of it, sometimes we can be more successful that way than just trying to say, here, have medicine, medicine, medicine. And you know what else is interesting about side effects? I learned this too, that a lot of people that have a mental illness like this that don't recognize their illness don't actually stop taking pills because of side effects. They will give that reason. And the reason they give it is because they hear other people saying that, and that is acceptable, right? If you took a medication and it gave you severe stomach pain, and you're sitting around a table with your family talking, you're like, yeah, they gave me this medicine and I had to stop because I had this terrible side effect. That's like a socially acceptable thing, right? That you would stop a medication for a side effect you didn't like. So they hear this and they think, yeah, you know, I say side effect, you say side effect, you said that, that's good, and people accept that reason. They don't necessarily have side effects, but they hear the reason and it's okay with people, so that's what I'm going to say. So when people have anosognosia, it's difficult partly for that reason. So sometimes we have court-ordered treatment or commitment. Criminalization, we talked about a little bit. There's more people that are mentally ill in jail than there are people in jail that did other stuff, if that makes sense. Mental health courts are something that we should all be working toward. And basically, they're courts specifically designed to intercept people with severe, persistent chronic mental illness. It doesn't mean that they don't have to take consequences for their actions, but what it means is that we focus the consequence on treatment. So whether it's residential treatment, therapies, whatever, along with that, because we know that just putting someone like this in jail is not the thing that they need. So these courts would be specifically designed for these patients. And then, of course, the goal is to move people into the community. We don't have a lot of state facilities, things like that, so we don't really want people in those places. It's not the best place for them. Statistics about people being in jail. You can't really recover in jail because prisons often lack counselors, therapists, you know, the things people really need to get better. And that's why. So when you do your assessment, you're going to assess for the usual stuff, right? Suicide risk, always being risk to somebody else or themselves. Being able to get food, clothes, all the stuff you would need to live successfully, right? It's the basic stuff that you need. Any kind of treatment adherence issues. If your patient's telling you they stopped going to therapy, that is a place that needs to be intervened upon, right? Because then they may also be working towards stopping medication. So we need to follow up on those things, okay? Self-care, certainly another place, okay? This is the place where, you guys got to see some of the case managers up in Choices. The case managers are those people that pull all the resources together. And people, when they're living with severe, persistent, chronic mental illness, they need those case management outside for all those same reasons. Who's going to help me get housing? Who's going to help me keep my job, get a job, and deal with some of the stuff that comes along with that, If you live in an apartment building and you have a chronic, severe mental illness, there are bound to be behaviors that freak your neighbors out. There just are, So you may need help with that, right? And there's stigma, so somebody's got to help with that stuff. So these are all different stuff. You have these slides, I think. These are all different things that you may need. Remember that psychoeducation, so if there's family members, helping them figure out where all this stuff is. So the old model was the rehab model, which focused on the deficits and the symptoms versus quality of life. That model was just all about what's wrong with you. The recovery model is the opposite of that. It focuses on choices and empowerment for the patient. It's the same for you and me. If you broke your leg and you were going home, it would not work out well to have a stranger come into your house and set your house up to work out for you, right? You know your own home. You need to set things up for you. So it's the same for them. In order for things to work in their life, they need to be in control. So the goal is to get them as much power in their own life as they can have. Psychiatric Advanced Directive, oops, I might skip this one. I think I just talked about this. Did I? Nope. Okay. The only thing I want to point out on this slide is NAMI. If we haven't talked about NAMI, I feel like I brought it up once or twice somewhere. I don't know where. That is the National Alliance for Mentally Ill. This is a huge resource for patients, for families. They have just everything. You can get online there. They have tons of resources for patients. They also have a lot of online chat rooms and support groups. So you live in a small area where there's nothing. It's a great place for patients to go in. It's a great place for families to go in. And they have just everything. I mean, this was a place that was particularly helpful for me when our daughter was diagnosed, because there was nothing here and I knew nothing. And so to even just be able to go in and say, so our kid is this old and she has this, and I'm feeling like nobody gets it. To have a few other people going, oh, hey, I got that similar situation, whatever. So if you can refer somebody to NAMI, it's a really good place to get some kind of support and help. Advanced directives, we already talked about those, should they come our way for mentally ill patients especially. We got telehealth now, so that's good. People can get therapy through telehealth. Live chats, stuff like that. So I think that because of your alternatives that a lot of you guys picked, you really were able to be aware of what's going out in your community, what's going on, the kind of problems that people have, so that when you intercept them through your career, you'll know, the different type of stuff that they need and where they might have come from. Okay, home stretch. Stay with me. You can do it. We're almost done. Okay.